Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I wanted to go through two or three and make them short videos on the temporal mandibular joint and let you know what really causes the pain and the discomfort and the things that we had to do to get it to stop hurting. And I've worked with the TMJ joint for about 30 years, and as honest as I can be, I think I got everybody out of pain, but I could not stop the click on people, and you won't be able to either. It's going to click, and if it's a late click, you won't bring it back into place unless you go in and do surgery and pull it back and sew it back in place, and that's a big job. So a lot of times you leave them alone, and people will use them even though the disc is not on the head of the condyle. So I'm going to try to get into this pretty quick and show you the actual shape and what you're dealing with here, and we'll have to take that. Now this is a real skull. This is not an artificial one. This is the real thing, and I got it about 40 years ago, and it has been a big help to learn things about the human skull and the things that you can pick up studying this skull. Now this is the temporal mandibular joint. This is the temporal bone up in here, and this is the mandibular bone down here, and this is the temporal mandibular joint. And when you have a problem with this, they call it the temporal mandibular dysfunction, or whatever you want to call it. It gives you a problem, and this is where the pain comes in. On the most all the TMJ problems I had originate in this area. Now I'm going to erase that and starting over again, and let me get to a little bigger joint picture. Here's a smaller one, and here's the ear opening, and this is the space. Now when the teeth are together back here, there's a space in this skull where the disc set, and the disc set right in this area right in here, and it was a kind of a double concave. It's bent here, so it's cupped in here, and it's got cupped in over the bottom, so it looks kind of like a something that would be like that. There's more of a cupped in area, and that shape of it helps it follow. Now when you open your mouth to bite something, the condyle will move out to here somewhere, and this disc will be on it here, and there's a ligament that goes to the top and one that goes to the bottom of it, holds it in place, and a small muscle that helps pull it out here in this area. Now if for some reason or another you get something in the mouth that is pushing this jaw in a distal direction, pushing it back, then it squishes the retrodiscal tissue. The disc is so dense, I mean, it takes so much force. Now if you move your jaw forward, this condyle will go out, and it'll be fitting somewhere like this. Well, I didn't leave space for the disc to be in here, but the condyle will be out here. And when you bite with your front teeth, there is nothing that touches in the molar. See, when I move forward with my teeth and bite on the front teeth, that the back teeth separate, and that's the way it's supposed to be. So you can bite through a sandwich or something. You cannot bite as hard forward as you can back between the molars, simply because the pressure in this area is too great. And when you bite forward, there's nothing touches but these two joints back here on the back and your front teeth here in the front. So if your jaw joint or this condyle is buttoned up against this retrodiscal tissue, which is a highly vascular tissue, it's got a lot of it feeds the synovial fluid to the joint out here, and it carries off the waste product in there. This is you can write a whole book on this joint. It's the most complicated joint in the body, and you have to take care of it. Now, if it gets inflamed up here, you bite and you hurt it, or you do something, or else maybe I had a girl got a TMJ problem. Somebody put a crown on one of her front teeth and made the back of it too thick. Didn't want to cut the enamel off, so when she bit down, her teeth hit that crown, and it shoved this condyle back, and by just that crown hitting wrong caused this to get irritated. She had a TMJ problem. So this old idea that orthodontics doesn't have anything to do with the TMJ problem is just a bunch of bull. Anything, your dentistry, and everybody that practices dentistry ought to know something about this joint and how to take care of it and everything. And that's why I want to go over this in complete, so that you'll really understand it. Now, the jaw joint looks, the whole jaw is the muscles attached to this in this area and pull it too. So they're closer to the joint than they are to the front teeth out here. So if I bite down with, say, 10 pounds of force over here, this may have 25 or more on both sides of it, press it. So you got to have tough material. I'm 94 years old, and my jaw joints are still functioning. So this tissue in there can last for years and years and years, and I've chewed and I've been hit from all sorts of directions and had it damaged some, but it got better. I didn't knock it off. It's still on there. And that's showing you how long it lasts. Now, it's not a round disc. It's kind of something like this, and it is attached with ligaments back here at the back, and the front also has a muscle that pulls it forward like that. Now let's go on to something a little further. Now, look at the shape of this. Now, it's not exactly a football shape, but when I bite to the side, so if I go over here and bite these teeth on the left side of my mouth, the right side of the mouth, these teeth don't touch. And that's, people, it is a complicated thing that the human body is so superly made. I don't see how it ended up this way. There's the condyle, and when we go to one side, this thing has to twist a little. It'll be angled over here. And then when you do that, this side over here, it also pulls it forward, and it gets up on top of the eminence. And then, so when I'm biting these teeth together, these don't touch at all, see? But the condyle touches back here. So the force is on the condyle and the teeth, and then these teeth are together. And you can bite hard over here, and the bone structure on that side of the face takes care of it. You can do a lot of hard biting, and that'll work fine. It's just, it just works super well. Now, this is the way when you move your jaw to one side. Say if I move over this way with my jaw, this will angle kind of like this, and this comes forward and comes down on the eminence. This pulls it down in this direction, and so the teeth on the left, let's see, the right side of the mouth would not touch if I'm rising over here. So these are the little things you just really ought to know. I know there's people, we're talking to people all over the world. I mean, and I know that many people do not understand what causes the pain and what can be done to stop the pain. In fact, if you really get it, what's causing it, you don't have to do medicine that takes care of the inflammation helps some, but you really need to get at what caused it, you see. And we'll try to cover that in some of these. It's going to take us about 3 or 4 videos to really cover this thing good. That's, I think, the end of what I'm going to talk about here, and I hope you stay with us and follow these other videos. We're going to go into the actual cut down of the human being and how it functions there, and then we'll talk about several other things about the TMJ. Thanks for watching, and I'm going to hang up here and hope you'll join us again on this jaw joint learn special deal. So I'm going to say goodbye. Thank you for watching now.